Crowds have returned to the streets of India as most of the country begins reopening. After 10 weeks, shopping malls, restaurants, hotels and places of worship are reopening. But at the same time, India is also reporting close to 10,000 new cases of COVID-19, taking its total to more than 256,000. New Delhi is a major hotspot, with Chief Minister Arvind Kejriwal falling ill as well. He will do a COVID test tomorrow. The hardest hit state of Maharashtra now has more confirmed cases than the whole of China. Its biggest city, Mumbai, is taking a more cautious approach. While roadside shops have been allowed to reopen, malls, restaurants and other businesses remain closed. Neha Punya is live for us in New Delhi. She joins us for more on this story. Neha, how has day one of reopening gone?
Steve, we've seen a mixed response from the general public on the first day of easing of restrictions, or Unlock 1 as the Indian government is calling it. After a gap of 2.5 months, we actually saw many people heading back to work, and cities like Delhi and Mumbai actually witnessed a traffic jam after a long time in many parts of these cities. But most people stayed away from malls and restaurants where eateries are expected to function at 50% capacity. Many businesses saying they're not ready to start operating yet because they don't have the required labor force to ensure that they're sanitizing every surface, and also ensuring that customers are sitting at a distance from one another. We saw, surprisingly, the biggest crowds at places of worship, places like temples, churches and mosques here in Delhi, especially from the early hours of the morning. Many people queued up outside these temples and mosques, wearing masks, getting their hands sanitized and their temperatures screened before entering these establishments. There have been some concerns, though, from various citizens of Delhi as well as other parts of the country who are calling the government's move hasty. They're questioning why, at a time when India is still seeing nearly 10,000 cases every day, at a time when it hasn't even hit its COVID-19 peak, the government is feeling the need to reopen establishments, encouraging people to step outside their homes, and many are questioning whether it's more important to save livelihoods at this time or save lives.
Right, so saying that, are there any fears that the numbers will continue to increase? Because despite the reopening, the numbers have gone to almost 10,000 today. I mean, new cases today. Will there also be fears that the restrictions could be reinstated if the numbers or things get worse?
The government is facing a lot of criticism on that front, Glenda, not just from concerned citizens who are questioning what the point of a 2-month-long lockdown was if you're going to lift it at a time when cases are still increasing. It's something that other countries have not done. They're only lifting restrictions once the increase in cases comes under control. India is not doing that, primarily because Prime Minister Modi is under some pressure to curb rising unemployment and also help the economy pick up pace. Many people, many experts have predicted that in this coming week itself, India will hit 15,000 cases per day, and that's a huge jump in cases, primarily because many people are going out of their homes, they're going back to work, they're interacting with one another. The Delhi Chief Minister Arvind Kejriwal, who himself is sick and will be taking a COVID-19 test on Tuesday, has said that many people are actually coming out of their homes without wearing masks. Many others are not actually practicing safe distancing, and the Delhi government will be reviewing tomorrow if there is in fact community transmission in the city state. And if that is the case, if cases continue to rise, the government has said that it will consider reimposing some of these restrictions, primarily because while currently India's public healthcare setup has been able to cope with the rise in cases, if we do hit a spike of, let's say, 20,000 cases a day or 40,000 cases a day, there won't be enough beds or ventilator machines for every person who needs hospitalization. And that's the big concern in India, even though the country has managed to keep its death rate pretty conservative and low, something the government says is a mark of how successful its 2-month-long lockdown has been.
Right, thanks for that update. Neha Punya speaking to us from New Delhi.